West wind at 3 miles per hour. 8:11, Steve and Ted here on KNSS on a Wednesday morning. That means time for Wednesdays with Wagle. Dr. Jason Wagle at Kansas Perio and Dental Implants. Good morning, Dr. Wagle. Welcome aboard this morning.
Hey, good morning, Steve. How you doing today?
I'm doing it. Today is my 70th birthday. Now, you actually seen my teeth. Do they look like they're 70-year-old teeth?
No.
That probably violates the dentist patient whatever there. But thank you, sir. Hey, well, let's talk about today periodontal disease and cardiovascular health. You know, people wouldn't think your teeth and your heart are somehow connected. But what's the most important thing to know about this, Dr. Wagle?
Well, there is a lot of research that indicates that periodontal disease may increase a person's risk for cardiovascular disease. I think some of the most important things to know is unfortunately it's not as easy as just brushing and flossing will ward off a heart attack or stroke, but we do know that maintaining periodontal health can reduce harmful inflammation in the body, and this may be good for your cardiovascular health as well. And one thing that I think it's very important to know is that it's important for patients with cardiovascular disease to see their physician and follow their recommendations, as well as patients with periodontal disease, they should see their dentist or periodontist regularly.
Do you see it very often in your practice?
We probably see this every day. We see a clear association between patients' oral health and a patient's general health. And this is why I think a significant amount of research is being conducted in this area. A large number of our patients have other health issues that can complicate their periodontal treatment and results, and this could include, obviously, cardiovascular disease. Treatment
and prevention. You talked a little bit about making sure you're seeing your dentist and your doctor, but is there any other prevention that we can talk about?
I think so. I think that if you see your dentist, they can do a periodontal evaluation. They should do this once a year. They should include detailed examinations of their teeth and gums and assessed risk factors. Patients with periodontal disease should probably let their general health care provider and or cardiologist know that they have periodontal disease so they can have better coordinated care.
At Kansas Perio and Dental Implants, I understand you've got art. I knew you had nice pictures, but you've got some art there. Tell us a little bit about that.
Oh, we have a lot of photography of Kansas and just some of the pictures that you might see or scenes you might see if you're driving around in the country of Kansas or in Wichita.
Oh, they're nice.
Something else.
Yeah, go ahead, sir.
Something else that we have, I mentioned this last week that I would mention 7 pieces of technology that we have that at Kansas Perio that improves patients' comfort and care. And I think this is kind of important. I mentioned it last week that we would talk about it, so I want to kind of just reiterate it today. We have 3D X-ray machines, obviously the iCat. We have 3D cameras that do digital impressions. We have Cavitrons, a periscope of fiber optic cameras that go below the gum line to help us clean the teeth more effectively, 3D planning software, digital x-rays, and we also have microscopes that magnify our work area 3 to 4 times for better visibility and accuracy.
All right. High tech.
Yeah.
Good to know.
Yeah, pretty high tech stuff.
Hey, thanks for being with us. When it's time to get serious about your smile, it's time to ask your dentist about Kansas Perio. Learn more about their services online at kansasperio.com or call 316-685-2731. Wednesdays with Wagle, Dr. Jason Wagle, 814 Steve and Ted.